Can it pass the House? Joining us right now, Representative Allyson Schwartz, a Democrat from Pennsylvania, and Representative Dave Camp, Republican from Michigan. Good morning, guys. Thank you for being here.
Good morning.
Congressman Schwartz, let me start with you. It doesn't include a public option. It basically supports the co-op option. Do you support that idea?
Oh, I support a public option. I think it's an important piece of the legislation that we're moving through the House. And of course, we knew all along that it was not likely to be included in the Baucus proposal. But we have a ways to go. What's important about this moment is that we are seeing a bill advance in the Senate. That's what we want to see happen. Of course, Senator Baucus has been working to try and get some Republicans on board. But we know that the American people want us to find this uniquely American solution to making sure that every American has access to affordable, meaningful health coverage. And so that's what we're looking to make happen. Obviously, we have a bill moving through the House. We want to see it move through the Senate. We want to make sure this gets done by the end of this year so that Americans can finally have that sense of security and stability about their health care coverage.
Congressman Camp, what do you like and what do you dislike about Baucus's bill?
Well, you know, the public option's been a bright line for a long time that Republicans wouldn't cross. It's a step forward. It's not in the bill. But still, that bill hasn't drawn any support, bipartisan support in the Senate. I think because there's still too much government, too many taxes in that bill. On the other hand, what we'd like to see are some common sense reforms that would help get the costs out of health care. And certainly malpractice reform is part of that. Obviously, getting the waste and fraud out of Medicare would be very important. And some insurance reform would be, I think, those are three things that I think could agree on, both Republicans and Democrats.
But Congressman Camp, it's hard to fight the numbers. The CBO estimates come out and say, in fact, given all the plans that are out there, this is the lowest plan. It actually will help reduce the deficit over 10 years, if not longer, and it'll cover 94% of Americans. It's hard to fight the statistics.
Well, it's still close to $900 billion, and Chairman Rangel has said it's about $100 billion short. So I think there's a real debate there. Look, this bill still would make it impossible for us to reward healthy behaviors, for example. And what we're seeing across the country is people who have made healthy lifestyle choices are bringing health care costs down and living better lives. This bill would prevent us from rewarding people who do those things. So there's still lots of problems in the bill. There's still way too many taxes. It's going to be a huge burden on the economy and on the American people.
Congressman Schwartz, if it does not have a public option, will you vote for it?
Well, I'm working hard to make sure that the public option is in the bill. I think that's important because it's going to help save money for taxpayers and help bring the cost of health coverage down for all Americans.
How is it going to save money for taxpayers if we're looking at possibly taxing health insurance plans, which would inevitably raise the cost of our own health insurance? I mean, I've heard multiple health insurance CEOs say that.
Well, I'm asking two questions combined here, but you know, the fact is that the bill, whether it's ours or the Senate proposal, which at this point is just that a proposal, is that we're looking to bring down the cost of health coverage for all Americans. And one of the ways we want to do that is to make sure that the premiums that our consumers pay is reduced over time as well, or at least stabilized over time. We believe that both bills have a real ability to accomplish that for Americans who have insurance now and see rising costs that are not sustainable. The fact is that we do need to do comprehensive health care reform. If we just sort of tweak it here and there on sort of simple things that we might agree on, that's going to shift costs. We have to make sure that we're all in this. We want individuals to take personal responsibility. We expect them to continue to do that. Those incentives are a good idea. They're going to be out there. But unless we actually make sure and enable all Americans to have access to meaningful coverage, unless we actually create an affordable option for people, and there's competition and choice, then in fact we won't be able to do that for Americans who are purchasing insurances or for businesses that are seeing those rising costs, or for taxpayers who are also looking to contain the cost of health care over time.
Congressman Camp, competition, I'm not sure I see a lot of competition in Baucus's plan, and I'm not sure that we're getting a satisfactory answer as to why we're not going to sell across state lines. What's the holdup? What's the issue?
Yeah, look, that's something that we ought to do. We ought to try to get larger pools of people to help bring costs down. We want to see costs out of health care. Look, on the one hand, we're going to find all these savings in Medicare to fund health care reform, but on the other hand, we're going to replace that with another government program, the public option, and that's going to be the most efficient thing we've ever seen. Look, that doesn't fly. That doesn't fly with the American people. That's why I think the public option really has to be out of this whole debate. Look, what they're doing will prevent people from being rewarded for their own healthy behavior.
Okay.
And what we want to see is healthy choices be made, and also then get lower premium costs because of that. The Baucus bill would prevent that. That's why I think you're seeing not one Republican senator has come forward and said, I'm for this bill. And frankly, you've seen disapproval on the Democrat side on that bill, too.
All right, representatives, we have to leave it there. Thank you guys both for joining us this morning. We appreciate it.
Thanks a lot.
We'll be right back in just a moment.